Hey, so welcome everyone to the Convergence HQIC Patient Family Engagement for Equity Think Tank. Really appreciate all of you joining us this month for our July Think Tank. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners, and really excited for our session today. We have a few patient family partners who have joined us to walk us through the milestone moments that has been put together. So excited to see all of the great work that these patient family partners have contributed to over the last 4+ years through the Convergence HQIC program. So excited to get to that. Again, if you haven't done so already, please chat in who you are, where you're from, your hospital, your role, and then would love to just celebrate with all of you. So please share something that you're proud of or excited about or celebrating today. All right. So just a reminder, these think tanks are an opportunity to connect online, just for shared learning. Over the past 4 years, we have gone through a variety of topics related to patient family engagement for equity, learned a lot, shared a lot together, and I just appreciate everyone who has contributed to these think tanks and for the greater good of the Convergence HQIC in relation to patient family engagement for equity. Anyone is welcome to join these think tanks. This is actually one of the last think tanks that we will host for the Convergence HQIC contract, but I'm sure there are plenty of other places that you can jump in and continue to learn and share with one another around these topics. So our next meeting will take place on Wednesday, August 14th. And that will actually be kind of an open coaching session for hospitals. We'll introduce a really exciting opportunity that we have to share later on in today's session. And for those of you participating in that opportunity, the next think tank will be a chance for you to just get additional coaching, ask questions, share things that your hospital is working on around developing strategies to engage patients and family caregivers in your hospital's improvement work. All right, so let's jump right in. So last month I had introduced the storyboard templates and this PFEE milestone moment template as well. This was an opportunity for all of the hospitals participating in HQIC to share interventions and programs and projects that they were really excited about and wanted to spread that great work amongst the other hospitals and share some best practices. This template, the PFEE Milestone Moments template, was actually co-designed with the patient family partner community for Convergence to really focus on, how were patient family partners involved in projects, impacted projects, and any pearls of wisdom to share throughout those projects as well. So the Convergence patient family partnership community had taken upon themselves to share all of the great work that they have done over the past 4 years and bringing it here to you today. So I'm excited to share, there we go, the Convergence HQIC Patient Family Partners Collaborate for Quality PFEE Milestone Moments. So at this point, I am going to pass it off to Libby to just get started and introduce the template and then welcome the patient family partners who are on as well to join in and share things that they've been excited about over the past 4 years and any pearls of wisdom as well. So Libby?
Awesome. Thank you, everybody. And yeah, I see that we're still having some wonky formatting issues, but aside from that, the content is really what I think is really important here, so we can work with the formatting in the future. As Lindsay mentioned, we developed this milestone moments together with our patient family partnership community that has been engaged with the Convergence HQIC since the start. So Really excited. You may all have been benefited from some of the collaboration we've had with the patient family partners, but maybe haven't seen it quite as clearly laid out. So a couple of interesting highlights. We have 38 patient family partners that represent 11 states, and that the number is great, but what's really very cool about the group is that it's very diverse. So we have lots of folks from rural communities, from urban communities, with all kinds of different, contextual. I think, oh, I've forgotten her name, from Colorado, but said something so wise one time, which is that we're all really struggling with similar problems in our healthcare systems, but that the local gives the context, and we're going to have different solutions. So having a diverse group of patient family partners is really important. Our areas of focus for the patient family partner community, it was to be in service to the Convergence leadership team, as well as the State Hospital Association Leadership Council. Those were our initial kind of marching orders, if you will, as to how we were going to integrate the Funfetti approach. However, as time went on over the course of the 4 years, we certainly were having more direct contact with the hospitals as well. So, and we were here to provide guidance, provide input and insight into many different resources. But on this milestone moment, we'll really concentrate on the development of the Ready, Set, Go tool, which I know this group has already been introduced to, so I won't lament, sort of how we got there or the two tools. Ready, Set, Go is to enhance your pre-admission contact, your bedside rounding, and your discharge planning. And then the complementary patient journey tool is to help patients and families navigate those three activities as well. And so I think what's really cool about this is the way that it was created in collaboration in the Convergence HQIC community with our patient family partners, but also with our hospital staff, with our State Hospital Association representatives. I think everybody had a hand in creating these two tools that were really important. It was really interesting as we started with the Ready, Set, Go, because of course readmissions is so important. It became very clear to the patient family partnership community first that, hey, it's great if we get hospitals to do these things, but if we don't raise the awareness for patients and families that, what their new opportunity is to engage in these processes, we will have only prepared one half of the partnership. And so they really initiated starting the patient journey tool. So these are available for download. Obviously, we've had 433 downloads of the Ready, Set, Go tool since it's been up. I think it's been about 18 months that it's been up now, and 234 downloads of the patient journey map, which has been up, I believe, closer to 9 months. Another just interesting measure, I just thought it was really important to acknowledge some of the work that Lindsay and Laura Carroll, one of our patient family partners, did a very profound recorded interview around the social drivers of health screening. And that interview has gone everywhere and has been taken up into many, many presentations. So when I was thinking about measuring the impacts of the project, I had to include that as well. So some of the insights, I think the patient journey map is empowering patients and makes them feel more control of their healthcare. That one of the things that resulted in this collaboration was that we all had a clear goal in mind. So we were all lined up to a North Star that we were working together towards. And that really made our collaboration that much easier. One of the other insights is there's just never enough time, not by the session and not by the project. And there's just always more to learn and be done. In terms of next steps and sustainabilities, PFCC Partners, our organization, will be taking the lead to keep this group of patient family partners moving, keep them engaged in the important quality improvement work that continues to go on moving forward. That's really important to us to continue, not only continue with this group, but to continue to expand the PFA network overall to ensure a multitude of diverse voices that are available, prepared, and ready to participate in quality improvement programs. And then some pearls of wisdom. I think the first one came from one of our patient family partners, and I just think that it really captures so much. Stakeholder engagement from all parties, right? We're not just saying you have to listen to the patients, but stakeholder engagement from all parties is the only way to draft policy that has teeth in it. So I'm going to stop there and invite any of our patient family partners who want to comment on the milestone moment template and sort of what we wanted to share forward. Anyone?
Just real quick, I agree with you on that first bullet point is wonderful. That is so true.
It is so true, right? I mean, when you engage staff that are going to be implementing these tools and creating the tools, that just makes so much more sense that they would have more investment in it.
Mm-hmm.
Michelle, did you have a comment? Anyone else? All right. Well, then I guess I will turn it back to you, Lindsay. Can I ask another question of the group, though?
Absolutely.
That's off topic and off agenda, but I did anyone else just get off the Convergence Health Equity session?
No.
No? Oh,
Michelle did.
Michelle, were you as impressed as I was with that presentation?
I was, and here, let me come off camera. Yes, I was, and my team, the rest of my team was on it as well, and I was like, okay, now they're just making me cry. And while we know the concept when they started playing the videos towards the end, while we know and can anticipate the fear of somebody who does not speak our language coming into our healthcare system, to hear them speak those words and to hear how that hospital responded and the processes that they made and the impact that it made on all of those individuals was just, I mean, it brought me to tears.
Yeah, so for those who didn't join, it featured Providence Mission Hospital here in California. And because one of their leaders had recently gone through a health equity program sponsored by Providence, they came back and looked at their sepsis and their length of stay for sepsis. And they recognized that limited English proficient patients were staying much longer. So they took that data, and instead of making a patient engagement program or patient education program, they went and listened to their patients and families and understood from their perspective and gathered those insights, and then created a quality improvement project to address those needs. And as a result, after 9 months of capturing data, they have significant improvement in length of stay for that population. They've also, developed a great relationship with their Spanish-speaking population that is served at the hospital by virtue of listening to them and then responding. And so that was the videos were from some of the patients that participated in the program and benefited and were alive because of the program. And so for me, it was just like, that's patient family engagement as a strategy to improvement. That's the holy grail, if you ask me. But so I just wanted to bring that in. And for any of you who didn't get a chance to see it, please, patient family partners, hospital staff, everybody on should really, understand what the value, the kind of change we can drive when we really engage that perspective with humility. They had to listen to some really rough stuff, right? And they listened to it and they put it not from the perspective of a patient experience, but more from, okay, how can we meet this? So yeah, I just, whew, when that comes out, you
Yeah,
grab it.
and we know how tight of a community that is. So the reach beyond those individuals that were personally impacted by sepsis, just think about the magnitude of those sepsis patients that come in and get caught earlier because they don't have that fear, because that their response and how they've handled it, that's just going to feed into the community. So hopefully we can get those, or they can get those patients into the hospital and under treatment quicker and not have a negative outcome.
That's, I hadn't even thought of that, but you're absolutely right. That is such a close-knit community that, yeah, to take that back. Anyway, sorry, I was a little, Nadine, do you want to come off mute and share?
It's so unlike me to raise my hand. I thought I'd do that, and here I have to come off mute. Yeah, I was just putting in chat there that I was just speaking to a local resident here, and she was saying, "Oh, who's normally not that forthcoming with me," and she said, "Oh, my daughter just had I can't help her. She's out of town. She had distended stomach after hysterectomy, which of course I've had, so I thought that was weird, and I could commiserate. And here it ended up she had sepsis. They never made the connection in the healthcare center she was in. And, I'll just say the proverbial could have died kind of thing. And here it ends up, I started researching, there's such a thing as a post-sepsis syndrome, and it can last up to a year afterwards. And it comes in many forms. And in her case, she was mentally not as acute as she used to be. And her husband noticed it, oh yeah, a big difference in her personality and her whatever aspect of mental changes. And here, that was the connection. And you can have that up to a year afterwards. So now I brought it to the attention of my healthcare system that I volunteer for, and it's now part of the discharge packet.
That's awesome. That's awesome. I think, yeah. And so you can imagine if they're in that community, or if there are others who maybe have limited English proficiency as well, like how do you get that information, spread across the entire community and really take an equity lens to the data that you're looking at.
And then how do you make that connection between whatever healthcare, whatever surgery or you had done, and something changes about you and you don't make the connection? It's so disparate,
Yeah. Other.
Well, I'll just add, that was something that I learned on that webinar too, was that there was such a thing as post-sepsis syndrome. And I wasn't aware that it could last that long, but what I appreciated about their, outreach to their patients who were experiencing sepsis was the variety of languages that were offered, the videos that they had, just all of these different ways to get information to their patients in a way that worked for them. And coming directly from what they heard from the patients. And I just really appreciated that, bringing awareness to, what sepsis is, what you need to do after, and what it might be like once you go home.
I agree. And I thought, largely they didn't bring in new resources. They revamped some of the resources they already had. They used Epic in a different way. They used a few of the nurses in a different way. So it wasn't like an added resource challenge. It was really looking at what they had and differently. Oh, sorry. Did my energy overwhelm the grid?
I think it did.
Oh. Anyway. Well, thanks for letting me take the conversation off track a little bit. But honestly, you guys, if you can look at that recording, I know it was very, very well received. There was over 100 people on the call, so I'm sure that, and I know we had already asked if those folks could participate on a CMS call that we're producing later in August. So more to come from that team, I'm quite sure. But yeah, really, really exciting.
Absolutely.
And Lindsay, I see that you put in over 200 views on the SDOH screening interview that you and Laura did. That is just really fantastic numbers. I think, you know, it really, for me, over the course of the 4 years and where we started in the pandemic and, you know, hospitals and just really trying to keep the doors open and do the best that they could through a just unprecedented circumstance, and to come all the way back around to a point where people just, you know, the health systems want to hear from patients and families, and 200 downloads may not seem like, you know, any YouTube influencer, but
No, not
I
by
can
any
assure
means.
you it's probably 199 more views than would have happened 5 years ago. So so that is progress. And I guess that brings us back to the milestone moments. Really, that's what it's all about. There's moments and there's milestones along the way. And the more that we share with one another, the more energy we bring to all of this work and the more knowledge.
Yeah, exactly. Sharing and celebrating together. And that's why I left this slide in, because I just think this is amazing, the amount of individuals that have accessed these resources, these co-designed resources. I just think that's absolutely something to celebrate, and all the patient family partners on, and, you know, hospitals and the Convergence improvement advisors that had been involved in this process of developing Ready, Set, Go and the journey map, and everything else that has been co-designed throughout this project. I just think it's something so exciting to celebrate. So kudos to all of you, all the kudos. And then I left this slide in just to see if any of the patient family partners, I see Karen, Nadine, Victoria, I think I saw Talia as well, just any final pearls of wisdom for hospitals who are, you know, on this journey to patient family engagement for equity, getting started, you know, working on strengthening the work that they've already done, and, you know, how they engage patients and families. Just wanted to see if there are any final thoughts. Yeah, Karen?
Yeah, involving the patient and family into your committees at the hospital level is so important. You will glean, as this says, pearls of wisdom, some things that you had never heard before. And you will have people coming in and visiting with you more comfortable in that setting than you visiting them in their hospital rooms when they're under extreme stress. So it's invaluable for you and your staff to learn more and how to promote quality, safe patient care.
Definitely. Thank you, Karen. Very well said. Appreciate that. Any others? All right. Yes, thank you, Karen. And I like how you said working with the patients, family caregivers, community members in the settings that are comfortable for them. So really going out to the community, talking, learning from the community and their lived experiences. So great. All right, well, in the last few minutes that we have, I am super excited to introduce our Gateways Ultralight series. So some of you may be familiar with our Gateways to Patient Family Partnership program. This was actually a learning series module that was previously located online. And in the last final months of the Convergence HQIC, we wanted to bring forward just some of those big ideas and key learnings that we have seen, you know, over the past 4 years, and then even beyond, and working with hospitals and other healthcare organizations to support the development of patient family partnership programs. So you will see starting next Wednesday, July 17th, a series of short videos that Libby and I are working on together, just to go through the step-by-step approach and, some of those first initial steps that your hospitals can take to either develop or strengthen your already existing patient-family partnership program. So those, like I said, will be coming out next Wednesday and will be rolled out weekly. So you'll get one video a week that will be rolled out through the listserv and located on our website as well. So more to come on that. But like I said, the next think tank in August, we would have rolled out, I think, a majority of the 5 segments that we're putting together. So that August think tank will be a chance for anyone who is viewing those short recordings to come and ask questions, tell us your new ideas that have come up, and just continue to strengthen the work that your hospitals are doing around patient-family engagement for equity. Any questions on that? Libby and I are having fun with it, so you might also be a little entertained as well.
We can be entertaining. And I just wanted to thank any of you who have submitted your final PFEE assessment. We much appreciate that and really are going to be speaking to that in this series as well. So we'll be speaking to the gaps that are identified through that final assessment.
Absolutely. Yeah, thank you. All right, well, with that, our time is just about up. If there are any questions or comments, we have a few minutes. If you'd like to please raise them now. If not, you can reach out to me at lindsay@pfccpartners.com or give our office a call. But if there aren't any other questions or comments, we all appreciate your time spent with us today and look forward to the Gateways Ultralight series and seeing you on next month's Think Tank. Thanks so much, everyone.
So long.
Thanks, Nadine.
Take care.